The Mayor Johnson out of Chicago, was asked about stopping the measles outbreak at a migrant shelter and future protections. Here we go. This is information that you can possibly use if you was in Chicago.
Now to the measles outbreak in Chicago and a new push to stop the spread of the disease.
We have learned some of the migrants who've been exposed may soon be on the move. Our Sabrina Franza live for us in Pilsen with what the city has planned. Sabrina?
Joe, the count now is up to 8 cases, 7 of which have been traced back to this shelter here in Pilsen, the largest migrant shelter in the city of Chicago. Mayor Brandon Johnson says he's looking to move vulnerable people out.
There are a number of individuals that, we're working towards a plan for quarantine, particularly vulnerable individuals, and we are finding those locations for pregnant people.
Those who are pregnant, who have other health conditions that do not allow them to be vaccinated, and those who have been exposed in quarantine.
We're trying to find places for pregnant people. What about the non-pregnant people?
City leaders announcing today they're in the process of looking for hotel space to house those people for the time being. Previously, Mayor Brandon Johnson said the quarantine period is 20 days.
Of those who were in that particular shelter, at one point there was some resistance to vaccinations.
Now the city says they've administered 900 vaccines, bringing the percentage of people inside the Pilsen shelter immune to measles up to 95%.
It could be 2 to 3 weeks before I develop symptoms. And so it usually takes about 2 to 3 weeks to know if the measures that we're taking today are effective.
Dr. Larry Kosciolik with Lurie Children's Hospital said it'll probably take weeks before this outbreak is contained at best. Though it's highly unlikely anyone vaccinated would be at risk of catching it.
So the virus is actually pretty stable where it doesn't develop an ability to evade the immune response. And so the vaccine that we have currently, that we've used for decades, is expected to be quite effective against measles forever, really.
One of the confirmed cases happened in a CPS student staying at the shelter. Today, the Chicago Department of Public Health explained how new arrivals attending CPS are eligible for a vaccine exemption, though they're still encouraging the shot.
They is eligible for a vaccine. I forgot the damn word that is used. Exemption, a vaccine exemption, but we out here with the measles.
Still encouraging the shot.
The goal here is to really balance the needs for students to be able to have the community and otherwise mental health and educational support that is provided.
Y'all do understand they is allowing migrants to have exemptions while your child has to have their immunization shots. And they is also allowed to go to school with your children.
By schools while they are in the process of getting connected to a healthcare provider.
Now, it's one thing to stop the spread, but another entirely to make sure that this outbreak does not happen again. We asked Mayor Brandon Johnson about the city's efforts to screen asylum seekers as they reach the city's landing zone. He said that is still the case, but they're trying to shorten the period which asylum seekers can see a physician with the Cook County Department of Public Health to be less than 90 days from arrival. Meanwhile, they say the vaccination rate right now at the landing zone is 100%. We're live in Pilsen.
100% on the vaccination rate. That's what's up out there in the shy.